Organizations become great or stay great when there's an uneasiness to improve further, a willingness to look critically at themselves and to identify areas for improvement.
When we survey our workforce, both physician and non-physician, that's what people tell us they're looking for, is fairness and opportunities and having their voices respected and their ability to contribute at the highest levels.
From wherever you sit in the organization, really, you can help foster psychological safety, challenge the assumptions, and advocate for change.
Hello and welcome to the Permanente Medicine Podcast. I'm Chris Grant, your host, and the Chief Operating Officer of the Permanente Federation. This is our last episode of the 2023 season, and we're going to look back at a topic that's really at the heart of what we do at Kaiser Permanente: equity, inclusion, and diversity in medicine. The last few years have shined an important spotlight on the need to have equity, inclusion, and diversity at the forefront of conversations around healthcare, both now and into the future. We have two exceptional Kaiser Permanente leaders who are experts on this topic joining us today, who also happen to be dear friends of mine. Dr. Nkem Chukwumerije serves as the President and Executive Medical Director for the Southeast Permanente Medical Group. He is also Executive Sponsor and National Physician Lead for Equity, Inclusion, and Diversity for the Permanente Medical Groups, partnering in advancing Kaiser Permanente's EID efforts with our next guest, Dr. Ron Copeland, Senior Vice President of National Diversity and Inclusion Strategy and Policy and Chief Equity, Inclusion, and Diversity Officer for Kaiser Foundation Health Plan and Hospitals. Dr. Copeland is a board member of the Kaiser Permanente Bernard J. Tyson School of Medicine and the National Organization on Disability. And Ken and Ron, thanks for joining me on the show today. I've worked with both of you over the years. I think, Ron, you and I go back a couple decades, and I certainly know your commitment to equity and inclusion. So I'm looking forward to diving into our conversation.
Well, thank you, Chris. It's an honor and a privilege to be here with you and Nkem today, and I appreciate the opportunity to share at least my insights on this important topic.
Thank you very much, Chris. I'm looking forward to the conversation with both you and Dr. Copeland.
Excellent. Kaiser Permanente and the Permanente Medical Groups have had a long history rooted in diversity and inclusion. To start out, could you each share a little bit about the proud tradition of this work at Kaiser Permanente, your roles within the organization, and how you became involved with our equity, inclusion, and diversity efforts? Ron, let's have you kick things off, and then we'll go to Nkem.
First, I would say, throughout Kaiser Permanente's, 75 plus year history, we've consistently taken a stand for equity, inclusion, and diversity because we see them as inextricably linked to our mission and serve as a foundation upon which the enterprise really has been built. And I think it's important to take note of the historical perspective as well, because what launched us into this space was the fact that our workers in the shipyards in California were infused by the great migration of people escaping Jim Crow laws and practices in the South, looking for better opportunities. And the majority of those people were people of color. And so we started with a highly diverse workforce and learned and witnessed the value that a highly diverse lived experience and workforce can bring in terms of talent, perspectives, and to bring innovations to strategy. What's also important to unlock the benefit of that is how people are treated and are we inclusive in our orientation. So we learned to take care of multicultural, multi-diverse patient populations with a similar workforce and saw the matchup and the benefit and advantage of that and saw that as a value add and cultivated that. We then moved forward later in time to recognize that culture and language was important to communication and building trust and furthering doctor-patient relationships. And so we invested in that aspect of our care and our journey for our workforce and improving quality of care. I think that the turning point for us was in the early 2000s when the Institute of Medicine published a journal and report entitled Unequal Treatment, Confronting Racial Disparities. And what that report did for the first time was to do a systematic and complete assessment of disparities in healthcare and identified race and ethnic differences as the driver of that change. That was a landscape change. And I remember when that report came out, it not only transformed our understanding of healthcare and quality improvement going forward, but for me, in terms of my personal conviction as a Black man living in America and a Black physician, gave me a platform and a framework for how we could take this work forward at Kaiser Permanente in choosing to lead in this space. And we have now moved forward with all of that into the equity space, which is where our current framework is, that says, in addition to celebrating diversity and inclusion and multiculturalism and recognizing that disparities are a definition of poor quality and needs to be overcome, that social justice and issues of oppression, discrimination, and racism also have to be accounted for as critical vectors, because even underneath the social determinants of health, some of these same vectors influence why people don't have access to care, why they don't have access to appropriate health services and food and nutrition, or are disproportionately exposed to trauma in their day-to-day lived experiences. And I think as a result of what has happened over the last 2.5 years with this racial reckoning period that we're in now, Kaiser Permanente has taken a firm stand on making equity commitments, has made health equity a formal dimension of quality improvement, and holding ourselves accountable for those outcomes measured in that way.
Wow, Ron, you gave us an enormous amount to think about, and what a historical perspective. And you're right. You know, the roots of Kaiser Permanente run deep in diversity, equity, and inclusion, and to a large extent define the values and the culture of our organization. Yet there's a need to adapt and to change and to strive to be better, and to also kind of be honest to the hard work that lies ahead. Nkem, I'm really interested on your personal journey. What makes you so compassionate and passionate about equity, inclusion, and diversity, and how you came to this role?
Yeah, no, thank you again, Chris. It's a privilege to participate in this. And thank you, Ron, for giving us a historical perspective of our journey through equity, inclusion, and diversity over the last several decades. I am a physician, a hospital medicine physician, and I served in several roles in Southern California, one of which was to serve as the physician director for Care Without Delay for Southern California region. In serving in that role, it got me experiencing the challenges of our members who actually have complex needs. And those members as members with socioeconomic disadvantages, and we needed to make sure that we had adjusted our healthcare delivery system to meet their needs. After serving in Southern California, I transitioned to Kaiser Permanente of Georgia, the Southeast Permanente Medical Group, precisely as Executive Medical Director. And I've witnessed in Georgia the effects of health disparities in different communities that we serve in Georgia. But about a year and a half ago, the Executive Medical Directors asked me to become the Executive Sponsor National Lead for EID to represent the Permanente Medical Groups in this work, along with Ron Copeland. Really to bring the unique perspective of our physicians and the Permanente medicine care delivery teams to the work, especially focusing on health equity, in addition to workforce and community. We've done a lot in that area, making sure that the EID strategies and initiatives are aligned with the Permanente medicine strategies. Partnering with Ron, we've worked together on a variety of areas. Focus areas include developing the KP equity principles, belong at KP Pass 1 and 2, in addition to now working on the enterprise strategy and the execution plan. So it's really been a privilege and a pleasure to work with Ron Copeland on these areas since joining about 2 years ago.
Thanks so much, Nkem, and what a journey that you've been on, and what rich experience that you bring from Southern California that's now being applied to Georgia. Over the last few years, a pandemic, social unrest, natural disasters, and rapid innovation are among the many factors that have forced those of us who work in healthcare to really step back and reevaluate, what does it mean to offer equitable care? In your view, how have the last few years spotlighted issues in achieving health equity, and what advancements have you seen in addressing this cause? And Nkem, why don't we start with you and then we'll move to Ron.
So the last few years has actually brought to the forefront of our discussion the areas of equity, inclusion, and diversity. The COVID-19 pandemic specifically has exposed the inequities in healthcare delivery systems in different parts of the country. You can see the specific disadvantages of people from socioeconomic disadvantaged areas who actually had more complications from COVID compared to other populations because of their living and housing styles and the patterns. But also, if you recall, in the last few years, we pivoted from face-to-face visits to virtual care and telehealth. And then that brought to the forefront our digital equity issues, right? Does everybody have the same access to healthcare when you're now delivering healthcare more virtually than face-to-face? So we've started addressing the digital inequities in healthcare. Also, one thing that it brought to the forefront, especially for us that are in Georgia, is this idea of healthcare mistrust. So many folks don't believe in vaccination because of histories about inequities and some of the research that has been done in the past. So we have to overcome that to make sure that we increase vaccination rates in different geographies and different areas. What has been very prominent for us, especially again with my experience in Georgia in the last 2 years, is the very significant, intense financial headwinds that healthcare organizations have had in the last several years. Has actually caused a straining of healthcare organizations to the point that they're closing hospitals. In Atlanta, just south of the I-20, 2 of the Atlanta medical centers were closed, one in the East Point and one in downtown Atlanta. And these are areas where we really have vulnerable communities. So this is just an example, again, where in the last 2-3 years, because of the COVID, because of financial headwinds, there are pressures on the health systems to make choices. And unfortunately, they make these choices to decrease access to areas where there is already poor access to healthcare. So those would be examples of what has happened in the last few years that kind of points to the need for us to continue the good work we are doing on equity, inclusion, and diversity, and recognizing the need to make sure that this is front and center if we want to have everybody carried along as we continue to our journey to equitable healthcare in America.
Yeah, it's such important insight. Ron, I'd love to hear from you as well.
Yeah, thanks, Chris. And couldn't agree more with Nkem's comments than as stated. But a few additional perspectives that I think we should also consider is, first of all, recognizing that during this past 2.5 years, this pandemic, as well as the racial reckoning happening simultaneously in the country, has really just highlighted and revealed the fragilities of our current systems. And when I say our systems, I'm not talking just about KP, I'm talking about healthcare systems across the country. The point that Dr. Chukwumerije made about the financial damage that has occurred on many health systems to the point where they can no longer be financially viable has been because our models are not aligned from an incentive standpoint in terms of wellness, prevention, going as far upstream to prevent illness and care and address it with consistency and a sense of urgency that we demonstrated during the 2.5-year period. But look at the aftermath of accomplishing that because of the frailty and misalignment of our health systems across the country. So I think those lessons need to be harvested and reviewed, and it should have big implications for how we think about healthcare policy, practice, coverage as we go forward. And there's some new frameworks that we have to respect and embrace in this journey, I believe. And so from my standpoint, equity is not simply the absence of disparities, but the existence of justice for all people. And that's new language, new thinking for healthcare to see itself in the context of justice and racial reckoning. And so as we understand and have learned about social determinants of health, these factors, these forces underneath are the root causes, if you want to go to the deepest level to address these social determinant disparities that we're commonly recognizing with Thrive Local and other programs to address the need. But if all we do is address the need at a symptom level, it'll exhaust us. It will bankrupt systems, if you will, and we're seeing some of that evident now. Some of the things I think we just need to think about as we're going through this transformation is how important it is, as we did during the pandemic, to form long-standing, inclusive relationship with key community elements, whether it's businesses, social support organizations, racial justice organizations, and so forth. I think it's important that we're building equity into the quality and performance accountability standards in healthcare through the accreditation bodies and others that we're able to influence. And as we're now leveraging technology in more important and impactful ways, and that will be critical frameworks for the future, let's make sure we don't hardwire and build in longstanding bias and inequities that give some people tremendous lift and benefit and efficiency, and others at least standing out in the cold, still not having appropriate access. And the last thing I'll say is we can only travel at the speed of trust. And where we have trust has been broken, to reconcile that has got to be an upfront and timely commitment that we all make to acknowledge what has gone wrong, what has betrayed the trust, to redress and reconcile that in meaningful and sustainable ways, and then to bring closure to it so that we go forward into this complicated future really in the best sense of alignment and collaboration possible.
Yeah, that's great insight and wisdom. And I don't think you can ever achieve alignment without a foundation of trust. So I love that perspective. Organizations become great or stay great when there's an uneasiness to improve further, a willingness to look critically at themselves and to identify areas for improvement. As we work to promote health equity throughout all areas of Kaiser Permanente, addressing workplace bias has been a consistent area of focus. On this front, our organization recently introduced an innovative employee training initiative called Belong at KP. Ron, I know you played a key role in leading these efforts. Could you share a little bit about how Belong at KP came about and what we hope to achieve with it?
Well, let me first of all, connect a few dots, and that is to make sure that we don't position in our minds or our hearts that Belong at KP is a single entity, a single lever that magically corrects a lot of the challenges and opportunities that we're addressing. Belong at KP is one of many levers, and is part of a broader framework for transformation of culture, people's workforce experience, and how we execute the mission of Kaiser Permanente. I think the framework, that we're operating on is really a 3-component framework, and that is based on the equity commitments that we made verbally and are now trying to execute on. We've made equity a priority. So that's the first part of the framework, is what is identified as a strategic priority, what is resource, what is given preference. That's what actually gets done, and that's what people focus on. The second part is to understand, and this is anchored in science. We're an evidence-based medical group and organization. And so what research for neuro leadership research has shown is that habits are formed based on biases and beliefs. And if these habits are cultivated and repeated, they become second nature. And then third is the systems that are based on those habits just perpetuate those habits going forward. So this is really about a decision and recognition of a need to transform a set of beliefs, of behaviors, and then changing systems to support them in a different way. Where Belong at KP comes into the picture is that is part of what we're identifying as changing of our ability to mitigate bias, understanding how bias plays a negatively and disruptive impact on decisions, on communications, on behaviors. So how do you correct that? And how do you address that? And then how do we reinforce that in a large decentralized organization so it can be scalable? And that is really focusing on teams of people who've all been through the same education and awareness around how the brain works with bias and how we can form new habits with reinforcement by calling out what we're seeing and holding each other accountable in positive and constructive ways. But Belong at KP has an educational and awareness building component, and that's some training to give people core ability to identify and name recurring forms of bias that are common in a workplace environment. And more than just how to name them, how do you actually mitigate them from a strategic and impactful way? And the only way you can build that across the entire organization and scale it is you got to have teams that understand this and practice this on a day in and day out basis. When we survey our workforce, both physician and non-physician, that's what people tell us they're looking for. It's fairness and opportunities and having their voices respected and their ability to contribute at the highest levels. So that's what we're trying to build, because if we can model that and build that for ourselves and have our entire physician and non-physician workforce experience that, it's going to better enable us to provide the kind of care and achieve equitable outcomes for the communities that we're trying to serve.
And you're right, it's so complex, and there's so many components to kind of addressing and advancing, equity and identifying all areas of potential bias and using science and data in the way in which we support communities makes just a ton of sense to me.
And Chris, if I could,
yes.
I'm sorry to interrupt, if I could just add one thing on this, because there is a belong part two, and I want to make sure that we're being comprehensive in what we're describing here. So we talked about belong at KP part one, bias mitigation. The second component of belong at KP is part two, and that's to make sure everyone has an immersion and an understanding of the role race plays in our society, and as a result of being in our society, the role it can play within our organizations and institutions. And so we can't be true to the mission ahead and our commitment to excellence and equity if we don't also take time to understand racism, its history, its framework, its invasion and systems, as opposed to just individuals. And that's got to be part of our transformational journey as well.
I appreciate the additional insight, because you're right. This is a ongoing long-term commitment in a journey that, it's a complicated topic, and the solutions and the education and the transformation has many components and parts to it as well. Nkem, I'm eager to hear your perspective on this. In particular, how do you see physicians participating in Belong at KP, and why is their participation so essential, so critical?
Belong at KP is really very important for the medical groups from a variety of areas. Number one is that it helps us, create an inclusive and fair workplace, and also improve the way we interact with patients. I just want to say this: in the medical school, we don't spend as much time as we should talking about equity, inclusion, and diversity. So having this additional opportunity with Belong at KP helps create the necessary awareness. It reminds me about the PRESS model, right? The PRESS model that talks about, do we know the problem that we are trying to solve? So do we have a problem awareness? Do you have the root cause of the problem? And then do we have the right empathy? Because that is necessary. Then you can actually be able to make the right sacrifice and execute on the strategy. So I think Belong at KP, both parts 1 and 2, as Ron said, are really designed to help us have very clear understanding of the problem we are trying to solve. Help us understand the root cause analysis. Why do we have this problem? And drive people to then have the right empathy and make the right sacrifice to execute on our strategies that we have. So it's really very important for the medical groups to be aligned as much as the health plan is in this. Health plan and med group are now participating in the part 2. So we are very engaged in the medical group, working very closely, because I think that we have to collectively, participate to get the right understanding so that we can, as especially the leaders, help lead the necessary changes that we need to make to improve our workplace and ensure that our people really, really are approaching this equity, inclusion, and diversity from a point of view of empathy, and so that they can drive to the necessary sacrifice that is needed to do it.
We've seen several innovative approaches used to incorporate equity, inclusion, and diversity into our daily practice at Kaiser Permanente and throughout the Permanente medical groups. How we build on this momentum and what more can be done when it comes to promoting equity in medicine. And Nkem, let's start with you on this.
Yeah, I think our framework we use to look at equity in medicine, we have to do a lot. We've said a lot about it already around community health, right? Making sure we have the right housing, transportation, and education for our members to actually seek care. I'm going to focus with 2 examples, right, in the healthcare delivery arena. So I don't know whether most of you know this, but in Georgia has one of the highest maternal mortality rates in the country. with women in the States 2 times more likely to die around pregnancy than the national average. A key factor in this disparity is the high prevalence of hypertension, especially among Black women, right? 51% of KP Georgia's obstetric population is Black, and 21% of this obstetric population has either chronic hypertension or hypertensive complications of pregnancy. This compares to only 10% nationwide. And 60% of these hypertensive patients, like I said before, are Black. So this is a very major challenge, especially when it's coupled with challenges with transportation to get to the clinics and seek perinatal care. So one example is just a story that we had from one of our patients, a single mom that has 4 children. The 4th pregnancy, she was enrolled a fully coordinated high-risk pregnancy safety program that was developed in Georgia with remote monitoring program that helped her manage her blood pressure. One thing that it did for her, because she had challenges with transportation, and she was actually able to record her blood pressure at home and send it to our electronic medical record. And the case managers and the social workers and our providers were able to contact her remotely. And then when she developed preeclampsia, it was actually identified in time, and she came to the hospital and had a safe delivery of her baby. So that's kind of an example of how innovation like remote patient monitoring program, the Cocoon, in fact, in Georgia, we just published it at the New England Journal of Medicine in the last few months. It's called the Cocoon program around perinatal safety that Kaiser Permanente of Georgia uses for our members, especially members who have disparity. Another example that comes to mind is the minimally invasive hysterectomy program in Northern California. We identified that racial and ethnic minority women are less likely than white women to receive minimally invasive hysterectomies for conditions that do not require the more invasive procedures. So after launching an improvement initiative, the rates for the less invasive procedures improved for all groups. So there's a lot of targeted programs where when we observe disparities, we actually have targeted programs for those disadvantaged population. But in doing that, we improve the health of the entire population.
Wow, those are great examples. Dr. Copeland, I'd love to hear your thoughts on what more can we do to promote equity in medicine?
Well, I think in the bigger scheme of things, we're certainly on a course to be intentional with our disruption of the status quo, understanding that it's inadequate, both in its substance and in its outcomes at this point. So it's a continuous improvement methodology orientation. So I think we need to keep emphasizing and pushing that from an equity framework. But I think at the other end of the spectrum, to drive results and to innovate in the space, one of the things that we've heard from both Med Group and health plan employees and from outside agencies across the country is the increasing importance of transparency and accountability. And so our ability to gather inputs from key stakeholders, both practitioners, clinicians, health plan staff, our communities, our patients. And it's so powerful to help us understand both experiences and outcomes. As the PMGs and our commitment to education and development of physicians for the future, we understand clearly the benefit of diverse representation. People want to see themselves reflected in the people that are leading and providing their care on a day-to-day basis. And we are, as we said earlier, a broad, multicultural, multidimensional organization, and investing in educational opportunities in all the health professions, including medicine, through our School of Medicine, the Bernard J. Tyson School of Medicine, the curriculum, the exposure that the next generation of physicians are getting to these very important issues of health equity. So they're going to be the generation of physicians that grow up with the benefit of Permanente medicine framework and understanding and systems, as well as understanding how you leverage that from an equity standpoint.
Thanks so much, Ron. This is such a far-reaching topic that impacts us all. And honestly, I could go on for the next 2 days with a million more questions, but I'd like to wrap up with a call to action from each of you. I'm sure many of our listeners, both inside and outside of healthcare, are wondering what role can they play individually, personally, in advancing health equity throughout their communities. What are some words of wisdom you can offer for those who want to inspire and be at the forefront of this work. Ron, why don't we start with you and then we'll go to Nkem.
Well, I would say, first of all, lead where you stand is something that each one of us can do. And what I mean by that is really around the attributes of inclusive leadership. And of the many attributes that are part of inclusive leadership, the one I would call up first and foremost in this time is courage. The courage to stand up for the principles that we believe in and our commitment to equity, the courage to examine your own bias and understanding of history and commit to learning through exposure and withholding judgment to hear other people's voices and respect their voices and learn. And the other element of courage is the courage to unlearn biases or habits you have that are disruptive and not aligned with what we're trying to accomplish. Number two would be, as they get rolled out further across the enterprise, that we'll all understand and embrace the equity principles, which is kind of like a code of conduct for all of us as we go into the equity space that relates to how we do our part to foster inclusive environments, how we hold ourselves accountable as individuals for our action or inactions, and how we advocate for equity and inclusion for all people and amplify that on a day-to-day basis. And then I would just say this is very difficult work, very challenging work. You're going to encounter resistance, so don't be surprised. But this is also about how we maintain wellness and well-being as we go forward. And I think part of the secret there is witnessing the powerful difference that interventions can make, the inspiration that comes from that, and that just keep in mind something that Dr. Martin Luther King Jr. said that I think is worthy of the cause in terms of a call to action. Number one is no work is insignificant. And his statement was that all labor that uplifts humanity has dignity and importance and should be undertaken with painstaking excellence. So this is a commitment to excellence, which we stand for. This is a commitment to equity, and it's a commitment to justice, and as kind of new language, new frameworks for our work. And if any organization can and should be able to pull this off, given our integrated model, it's Kaiser Permanente. So remain inspired, manage and lead inclusively where you stand, make a difference there, and stay on a continuous learning journey.
I love it, Ron. It's incredible words of wisdom, and you're so right. It takes courage and perseverance and tenacity and commitment and listening and empathy to drive change. And I'm so glad that you are at the forefront along with Nkem doing this important work. Nkem, so interested in your words of wisdom and your call to action for all of those that are listening on how they can impact the communities that they serve.
I think I will just emphasize what Ron shared is really encouraging all of us to embody our equity principles, right? I think embodying it is really very important and very practical, right? Just to participate in the Belong at KP program, Pass 1 and 2, as we roll them out. I think it's very important. Then understand a little bit about how on the root causes have the right awareness so that it can drive us to the right empathy, commitment, and sacrifice that we need, especially as we roll out our equity execution plan. We will need folks to be in that mindset to be able to help roll that out for us. The other thing I would just encourage all of us to do is to look at data broken out by race and other demographic characteristics, and think about how policies affect different groups when we're making decisions, and involve diverse group of people in decision making. I think those are very important. And from wherever you sit in the organization, really, you can help foster psychological safety, challenge the assumptions, and advocate for change. That's really what this needs. So it's a commitment for people to really embrace all the programs that we are rolling out and being advocates for change.
I love it. And everybody can be an advocate and everybody can lead where they stand. And I hear a very clear call to action that now is the time. Have the courage, step into the conversation, use data and information, and be a leader of change and transformation. This has been such a thoughtful and inspiring conversation. As we all know, the pursuit of equity in medicine is a journey. It's not a destination. And you both have so eloquently indicated that. So I know there's a lot of work ahead, and a lot more to do along the way. But it's conversations like this that really make me feel like we're headed in the right direction. And Ken and Ron, I'm grateful for your commitment and for your leadership. The future of equity, inclusion, and diversity at Kaiser Permanente is really in excellent hands with both of your leadership.
Thanks for the opportunity, Chris. Really appreciate it.
Yeah, thank you very much. Thanks for inviting us.
And I want to thank again all of our listeners for tuning in this season. I've enjoyed the conversations I've had with some incredible leaders in healthcare, and I look forward to returning for a whole new season of the Permanente Medicine podcast. Catch up with past episodes by searching for the podcast on your favorite streaming service, and keep a lookout for bonus episodes throughout the year. And I hope you take the time to subscribe or to share a review. We'll see you next time. The opinions expressed on this podcast are those of the speakers and are not necessarily the views of Kaiser Permanente, the Permanente Medical Groups, or the Permanente Federation.